This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
Introduction. Various public health hazards have become a significant threat to different populations throughout human history. The phenomena of a global pandemic, a fast-moving spread of harmful disease, has been discussed in numerous literary pieces, providing the later generations with the opportunity to compare and distinguish the diverse instances of contagious illnesses. Given the negative repercussions caused by the Black Death, one of the most devastating pandemics over the course of human existence, and the development of COVID-19, some researchers outline similarities and differences between these afflictions. This work will highlight the major similarities and differences between the Black Death and COVID-19, providing relevant evidence establishing the distinction between the two diseases. Prominent contrasts observable in advanced healthcare and government structure. The scientific developments achieved since the end of the bubonic plague considerably separate the response to this disease from modern coronavirus handling. The availability of highly complex treatment systems and the provision of medical care to the majority of the population alleviates the potential negative effects of the virus, allowing sick individuals to receive necessary medications. Although a substantial amount of lethal outcomes still occur, clinical assistance plays a vital role in reducing the number of deaths and avoiding adverse complications. In addition to improved care, the possibility of creating and distributing a successful vaccination is another crucial contrast between these contagions. According to the materials from the Decameron, a 14th-century account of the terrible onslaught of the Black Death, it was virtually impossible to develop and administrate any serums or potential cures. However, in the current environment, new vaccines and treatments are being invented, tested, and released to the public, establishing a certain immunity against the disease and securing future victory over the pandemic. An imperative element for this discussion is the enhanced structure of the world's governments, which aid in the battle against the virus. In comparison to the Black Death, where people perceived the plague as impending doom and the cause of anarchy, in the contemporary setting, the state provides its citizens with the necessary protection. Numerous officials, with the support of private corporations, participate in instituting proper control over the infection, managing the public reaction, and confronting the consequences of the illness impact. For instance, necessary laws regarding the necessity of face masks, gloves, and the use of disinfectants are being introduced worldwide, promoting the safety of numerous individuals. Therefore, although the mentioned measures are not perfectly effective, they significantly reduce the progress of the coronavirus. Another instance of governmental support is evident in the financial aid distributed by the country's officials in order to enforce the isolation strategy. In the medieval environment, the lack of knowledge regarding the plague and the economic state of the European governments did not allow for the inclusion of these methods. However, in modern circumstances, this approach is practiced by several developed states. Even though the discrepancies between the First World and Third World countries hinder the implementation of these tactics all over the world, substantial development has been made since the time of the bubonic plague. General attitudes and public response as primary similarities. The striking correspondence between the Black Death and COVID-19 lies in the overall attitude towards the progression of the pandemic, which remains exceptionally diverse until this day. Decameron portrays the negative consequences of contagious diseases, depicting how distinct and contrasting individual reactions can be. While some people might respond responsibly to the installed requirements, fulfilling the recommendations of isolation, hygiene, and diminished personal contact, others incorporate a drastically different approach, which hinges on the non-acceptance of the existing regulations. The negative response to the necessary facial masks, social distancing, and disinfection becomes evident in several population groups, who seem to display distrust towards the authorities or a desire to violate the demands. Hopefully, as the lethality of COVID-19 remains little and novel scientific advancements are being introduced frequently, such a blatant reaction towards the requirements will not adversely impact the citizens. Conclusion. To conclude, the prominent similarities and distinctions between the Black Death and COVID-19, namely technological improvements, governmental aid, and public reactions, were discussed in detail in this paper. Given the incredible academic enhancements accomplished since the onset of the bubonic plague, the response to the coronavirus is remarkably more organized, adaptive, and effective. Furthermore, as the financial and structural organization of the world governments significantly advanced over the centuries, a much more positive trend toward the elimination of illness can be observed. Only one similarity in the approach towards the pandemic, the public attitude, unites the two events and demonstrates the universality of people's reactions towards the contagions. Overall, the lessons learned from the response to the bubonic plague can significantly enhance the elimination approaches used today, securing higher efficiency rates and promoting awareness among the citizens of the world. If you want to find more works like this essay on the Black Death and COVID-19 comparison, head over to ivpanda.com. It has a collection of samples with thousands of submissions covering virtually all academic subjects.